My capstone project is Auditory Processing Disorder, its diagnosis, cognitive impacts, and interventions. In my presentation, I will talk about the definition of APD, introduce my capstone project, and researches and opinions in our professions. After that, I will review 2 articles, my future work, and references in this research. AAA defined APD as difficulties in perceptual processing of auditory information in central nervous system and the neurobiological activity that underlies that process. There are 5 key points of APD. First one, it is an auditory disorder. Number 2, not all learning language communication deficits are due to APD. And number 3, it needs to be carefully and accurately diagnosed. Number 4, APD can only be made by audiologists. And number 5, the treatment should be highly individualized. Part 2, Capstone Project Introduction. There are 5 tasks in my capstone project. The first one is to figure out relevant deficits and impacts from APD, which is I'm doing now. The second one is to develop structured training programs towards APD. And the third one is to create APD brochure and translate it into Chinese and distribute to Chinese hearing impairment communities. Now let's go to researches and opinions in our professions. There are some common grounds between ASHA and the AAA. They both believe APD should be diagnosed only by audiologists, and the interventions are bottom-up AP and top-down cognitive training. However, there are some discrepancies and fierce debates over APD. Some professions think APD does exist and interventions are effective. They did a lot of therapies and experiments all over the world. The rest part think that APD does not exist and interventions are invalid. These are the representatives. Section 4, Article Reviews. I investigated 3 aspects in APD. Could present APD standard accurately reflect the real-life listening difficulties for suspected APD children? 2. How do the auditory processing abilities and high-order function abilities link and impact each other, and how would they cooperatively impact other academic performances on children with APD? Number 3. Should every cognitive test or subtest be included in APD assessment? Which one is effective? Take attention tests as an example. In this presentation, I would just review the first 2 articles. The first article was called Setting Appropriate Pass or Fail Cutoff Criteria for Tests to Reflect the Real-Life Listening Difficulties in Children with Suspected APD. It was within subjects group design. 109 67 boys and 42 girls, English-speaking mainstream school children aged between 6 and 11 years old with suspected APD were involved in the research. It was descriptive research because no IV was manipulated, and the researchers relied on comparing values of the DV, and the purpose was to find out the pass or fail cutoff standards, the number of the test fails, and the nature of tests that could help professions properly predicting the real-life listening in these children. There are 2 hypotheses in this research. The first one is Performance 1 standard deviation and 1.5 below the mean is better measure than performance 2 SD below in at least 2 APD in the children's auditory performance scale domain. The second hypothesis was cognitive tests, but not the AP tests, can predict listening difficulties. The results and conclusions showed that 1.5 SD below the mean were performed better than 2 SD below mean. CHAP's memory and attention showed that 1 SD below the mean performed better than 1.5 or 2 SD below the mean. These two conclusions validated the first hypothesis. The third result was CHAP's ideal, memory, and attention were correlated with 7 APD tests, which validated the second hypothesis. The strengths of these articles were that they used a standard CHAP score in relation to the normative data extracted from sample, and they used cognitive tests to verify the symptoms of APD. The limitations were the age and overlapping symptoms issue, because age 6 is not considered as appropriate age to diagnose APD, and overlapping symptoms with other disorders like ADHD, AOD, SLI were not ruled out in this research. The second article was the impact of auditory processing and cognitive abilities in children. It was between subjects group design. 155 mainstream school children between age 7 and 12 within normal peripheral hearing were divided into clinical group and control group. It was also a descriptive research. The purpose were to explore cognitive impacts on AP and the joint relationship between AP and cognitive skills and their co-impacts on other performances. There are 3 hypotheses in this research. The first one was the correlation of the text within the AP batteries. The second one was the impact of AP texts on real-life listening. The third one was the cognitive influences on AP tests and other performances. All the results validated the hypothesis. The strength was the rigorous research design, and they ruled out the mutual influential effects within the batteries. The limitations were no degree of impacts were mentioned, and it did not include audited media population, and no speech tests were found in the research. My future work. Right now, I finished the step 1. Figure out the relevant deficit and impacts from APD, and these are the to-do list in the future. References. These 2 articles were presentation articles. These 9 articles are researches and opinions stated in section 3. For these 4, they are APD supporters. These 4 are APD non-supporters. This one is about the intervention common ground, which is bottom-up and top-down intervention skills. Finally, I will give my sincere thanks to Dr. Tucker, Kemai, Longren, and Professor Mankoff, who gave me great support and valuable research guidance in this project. Thanks for listening to my presentation on auditory processing disorder. Your advices and suggestions are always welcome and highly appreciated. Thank you.